Hi everyone. I thought I'd come on and do the video that I was meant to do a couple of weeks ago, but I've been really poorly dealing with a UTI, and I'd fell down the stairs. Not fell down the stairs, sorry. I didn't fall down the stairs. Had a really bad dizzy spell and headbutted the wall. The doctors think that I could have POTS. It's just one of the many things that I have to mention to cardiology when I eventually see them. I've also recently been told that I have a prolonged QT interval on my ECG that I've not long had, and that not only that, but I've also been getting a lot of ectopics or PVCs over a short period of time. I have a small device called a Cardia machine, which I'm not being paid to or sponsored by to mention this device, but I use this device. It's a one lead ECG or AKG reader, and it basically does a reading of a one lead over 30 seconds. Mine was showing that I was having a lot of PVCs over a 30-second period, hence the reason why I've been in and out of hospital recently with my heart issue. I do have another heart issue called supraventricular tachycardia, and I'm on medication to keep my heart rate down. However, I have done a home reading test for POTS that I'd seen on a fellow vlogger's site, where you use an oximeter, lay down for about 10 minutes, have a resting heart rate, and then you stand up, and in the first 10 minutes, if your heart rate increases by 30 plus beats a minute, if 40 if you're between the ages of 12 and 19, then you could be likely to have POTS. I unfortunately cannot lay flat on my bed because I have something called laryngeal reflux. I state it as LPR. Other people might know it as silent reflux. On top of that, I obviously also have gastroesophageal reflux disease. So I have to sleep elevated, roughly around about 30 to 45 degrees, depending on how bad my flare is. If I don't sleep elevated, the uvula at the back of my throat will actually swell up and I won't be able to swallow. So I did this test that I'd seen on a fellow website. So if you're watching Izzy, thank you for that video. I basically put my oximeter on. I laid down as flat as my body is allowed to be laid, bearing in mind I'm still on medication for my heart issue, which helps to keep my heart rate low. My heart rate was resting at roughly around about 65, 66 beats a minute. I then stood up and my heart rate quickly increased within the first 30 seconds to around about 105, 107, something along them lines. I know it definitely wasn't lower than 105. It then slowly started to decline, and it hovered roughly for the next few minutes between 95 and 100. I then laid back down to the way that I always lay down again, and my heart rate quickly lowered to 57 beats a minute. I know that this is not a diagnosis of POTS because obviously you have to see a physician for that, or a cardiologist for that. I'm awaiting to see the cardiologist, but due to all my dizzy spells, and due to the nature of the fact that I've fallen down the stairs through passing out, hot water makes me feel super nauseous and lightheaded. That's one of my triggers. Standing up for too long, that's another one that will get me. Having this conversation with my GP and the fact that he'd noticed a bruise on my head, which is still roughly around here, but unfortunately you can't really see it at the moment because of the fact that I'm in a dark room because I've got a headache. So I mentioned this to my GP, asked him was it a possibility that I could have this. He said absolutely. I already have other symptoms of dysautonomia. I have the memory and concentration issues. I have, like I said, the dizzy spells and vertigo. I've been looked into that for many years. I get the migraines. I get a lot of other stuff, breathlessness, you know, a lot of the things that you get. So it wouldn't be like, it would be understandable if I did have POTS as well. I do have electrical imbalances with my heart, and I do go into supraventricular tachycardia, but I also have normal fluctuations of tachycardia as well for no obvious cause. However, I would like to know that if anybody does suffer with supraventricular tachycardia and has Ehlers-Danlos, if you know if there's a link between the two, can you please mention it below, because no one can really give me this answer, and until I actually see my cardiologist, who may also not know the answer to this, it would be good to pass the information on to them if there is a link somewhere along the line. I know there's a link with bladder issues and stuff like that anyway, and I have a lot of bladder issues. I have a partial prolapse of my bladder. I have a fluid retention sometimes, a lot of the time, because I don't actually drink enough to actually get rid of it. And I also have frequent UTIs and mild inflammation of my bladder. So I must be on like about my 8th or 9th UTI in the past year. But anyway, moving on. I don't want this video to be more about me. I actually wanted this video to be about kindness and being kind to each other. It doesn't matter whether you are suffering with a chronic health issue, and I suffer with many chronic health issues. It doesn't matter if you're caring for somebody with a chronic health issue, or whether you're just a student or whoever you are. It doesn't matter who you are. If you're being bullied or you're being spoken to like a piece of dirt, or someone's being nasty towards you, or you're suffering with anxiety or depression, one thing I will say to you is it's very, very important to talk, communicate, and ask for help to whoever you feel is going to listen and actually understand your issues and your problems. For me personally, in the last 12 months, I have struggled really badly with anxiety. I've had panic attacks. I've been really low and depressed in my mood. I've had last few days have been awful for me. I know it's been awful for my brother as well, who's been caring for me. And it's really, really important to communicate. I find it difficult to communicate sometimes, and I don't think my brother fully understands where I'm coming from. And it's really important that you have someone that does understand. But the majority of the time he will understand, and he's very supportive. But I also went to my GP, and I asked my GP for cognitive behavioural therapy, which is CBT. I also said I didn't want to be on tablets because I would rather have strategies on how to cope rather than be stuck on medication 24/7. Unfortunately for me, I live in England and we have an NHS service, which we get our treatment free of charge. However, we have short spaces of time with doctors, but when we are waiting for something, we can be waiting a really, really long time. I just remembered realised I pointed to the wrong side of my head for the bruise, because my bruise is actually here. But yeah, I've had to wait almost 12 months now to see CBT. I did do an online course that was showed to be not very beneficial towards me, and that I needed a more one-to-one help. As a result of that, and obviously being diagnosed with my mediastinal mass, and not knowing the main diagnosis for that and what's going to happen with that, my mental health has come crashing right down. In the midst of everything that was going on, in the end of May, beginning of June last year, I lost my granddad very suddenly to lung cancer. And I've been the butt of people bullying me and being nasty towards me, and, you know, coming up with stupid things about me, and even saying things to me online that are disrespectful, not just to me, but to other people with chronic health issues. They are deplorable in things like one of the comments I got, which has since been removed, and I'm glad it's been removed, is that somebody thought I had Munchausen's on proxy for two reasons. One, because of the fact that my son uses a wheelchair, and yes, he can walk, and I will explain that in another video that's coming up with regards to his kidney condition. And also because of the fact they believe that I use my NHS service more than a cancer patient. Now, that is wrong on two sides, and it was very personal to me on two sides. One, because of the fact that I'm dealing with a growth inside my chest cavity right now that, although I've been told it's fluid-filled and growing, there still could be cancer cells within that mass that I don't know about and that the doctors don't know about, because I've not had a sample of that fluid or a sample of that mass be taken off and biopsied. So that's been a worrying time for me and my family since September of last year. On top of that, like I said, I lost my granddad very suddenly to cancer in the end of May, beginning of June last year. I think it was the last May bank holiday we had last year, and we were told that he had around 6 to 9 months left to live, and then 2 weeks later he was gone. And that was devastating to us, and we're still in that grieving process as a family. So I was quite annoyed by that, and that person had gotten very personal, and that's what upset me more than anything else. But to put somebody who has chronic health issue in the same category as somebody who has cancer, I can some kind of understand where that theory would come from, because obviously cancer is a chronic health condition, and so is Ehlers-Danlos and a couple of other health issues that I actually have that also coincide with Ehlers-Danlos. My SVT is not classed as a chronic health condition, but it is chronic to me because it's actually debilitating, and I've had to deal with this now for the past 4 years. On top of that, it's more debilitating and more chronic if you have Wolff Parkinson White, which I have not been diagnosed with. However, I have got some other heart issues that are potentially, or could be potentially, life-threatening if the cardiologist agrees with what the ECG is stating. At the moment, everything's up in the air, and when things are up in the air, your mental health goes downhill, and you struggle with it. So, but like I said, cancer patients and somebody with different types of illnesses and chronic health issues are technically not the same. The reason being, yes, they're both chronic health issues, but somebody who has cancer, unfortunately, and it's devastating, don't always have the ability or the chance to use the resources and the treatments that are available to them, because the cancers could be terminal, they could be fast acting, and they don't live long enough to actually use the resources. And that's a shame, and it's heartbreaking. I know or they'll catch an illness and pass away. I know for me, my granddad caught pneumonia and he passed away very suddenly within 2 weeks of being told he had a few months left to live. You can't put somebody with two different ends of the spectrum of chronic health issues in the same category. It's just not right. And anybody that I've mentioned this comment to have been disgusted in it, quite frankly. So I'm glad that their messages had been removed. But like I said, I have been the butt of bullying and nastiness pretty much my whole life. I've been the target of abuse and just horrible things in my life. My children have been bullied. You know, it's not something that society should be doing. I think that, you know, people should be kinder to each other. I think the best thing for anyone to do if they witness someone being bullied or they are being the one that's being bullied, I think you should go and seek help for that person or seek help for yourself. Go to a teacher, go to your general practitioner or your GP, as we call them in the UK, like your doctor. So go to them, call up the helplines that are available. If you're in the UK, them helplines might be Samaritans, Age UK, NSPCC, Childline, whatever it is that you're suffering with, you are not alone with this. It's very important to talk to your family, talk to the friends that you might have. If your friends are not sticking up for you and stuff, think about it in two ways. First of all, your friends might not want to stick up for you because they don't want to then be the target of the person who's bullying you. But also, if they're not going to go and speak to the teachers with regards to what's actually happening to you as well and back you up on that, then they're not really real friends. It's very important that you talk to somebody about it. Don't listen to the comments of "you're unworthy, nobody loves you, everyone hates you, you're ugly." Don't be listening to them negative comments, because they're not true. You are a beautiful soul. You are a lovely person. It doesn't matter whether you have chronic health issues, a disability that somebody can see, a disorder that makes your face look distorted, or you have tubes coming out of you, or no matter how you look, the color of your skin, the religion that you take, it doesn't matter who you are. You are a worthy person and you are wanted in this world. Please do not think that you're not. Listen to your parents if you trust what they're saying. I know when you're surrounded by negative comments all the time at school, in particular, when you come home and your parents are saying to you, don't listen to that, ignore that, we love you, you're beautiful and all this, that and the other. It can be hard sometimes to actually believe that your parents are telling you the truth, and it's so easy to get bogged down with all the negativity that's around you. But you need to rise above that. You need to take the negativity with a pinch of salt and move away from it. It's very important that you are kind to each other. I mean, I find myself now, if I'm at the hospital and somebody glances in my direction, I'll give them a smile. You don't have to talk. You can just smile. And they're either going to think you're crazy or they're going to smile back. But I think the biggest thing that you can do, and the bravest thing that you can do, is actually come forward and say, I'm struggling. I need help. This is what's wrong. I know for me, it was very difficult to go to the doctors and say, I'm suffering. I need help. I can't leave my house. I'm really, really struggling to go out by myself. And that I didn't want to be on tablets. Unfortunately, I've had no choice but to go on tablets because of the waiting times that our NHS currently have. But that still doesn't make my life any easier. And my quality of life is quite poor because nobody seems to want to help me try and get better and move on from that, because I'm still waiting for that resource to be available. However, I know that regardless of how many arguments I cause or how much stress I create, I know that I've got my brother's support. I know that I've got my mum's support. I know that my children have got my back as well. And I know that's a bad thing to say because children shouldn't really have a parent's back. But at the end of the day, I know that they love me, and I know that no matter what, they will always love me. And that's what's important. Somebody loves you and you are amazing and you're a wonderful person. There's a big thing at the moment going around with the celebrities stating that, you can be anything you want to be in the life. And we tell our kids this all the time. You can be absolutely anything you want to be in life. If you work hard and you achieve it, that's great. But if you want to achieve anything in life, you need to be kind. Kindness goes a really, really long way. I know I'd wish that people are kinder to me, but unfortunately, you can't predict what someone's going to do or somebody's going to say. I mean, the person that came back with that comment about me having Munchausen's because of my child being in a wheelchair and that I use the NHS more than somebody with than a cancer patient would use, they didn't know that, I just lost my granddad recently, and they, are just assuming that I've just bought a wheelchair and stuck my child in it. And they're just assuming that, I use the NHS a lot. I do use the NHS a lot, but they're not always my appointments. They're not always for me. And the majority of the time I go to hospital is because I've got a cardiac issue. And unfortunately, if you have a cardiac issue, the rule of thumb is you go and seek help, because your heart and your brain are the two main functions of your body that keep you alive. If you have any signs of a heart issue or your heart is racing or whatever, the first thing that they will tell you to do is go to hospital. I never call an ambulance for myself. We have a service provider with the NHS here in England where we have a telephone number we can call. They will advise us to go in to see a doctor, or they'll advise us to go to hospital. If you ring up with a cardiac related issue, they automatically will call an ambulance for you. Even if you only live 2 minutes away from a hospital, they will still call an ambulance for you, because of the fact that they don't want you driving yourself. They don't want somebody else taking you that could be potentially there to save your life if your heart stops. They will automatically always call an ambulance for you. I've never had to call an ambulance for myself. When it comes to my heart issue, I would personally rather just see my GP or get an appointment with my GP. But unfortunately, that doesn't always happen. A lot of my heart issues happen in the middle of the night while I'm asleep. So I have no other option than to dial this service provider, and they do what they think is best. We have an out-of-hours GP that is based in our hospital. So at weekends, we don't have a surgery that's open that we can go to see a doctor. We have to go to our hospital to see a doctor. And the majority of the time I'm in the hospital, I see the doctor. I see my general practitioner or a general practitioner. I don't see an A&E doctor or a specialist doctor or consultant. I will see a GP. Like when I went for my tonsil stone, I saw a GP. I did not sit in A&E waiting to see a specialist doctor. I was sat there to see a GP. I remember I'd had an abscess that had to be surgically removed because I was at risk of becoming septic. And I was sat in A&E every weekend waiting for my dressing to be changed. And I actually had a go at the staff at the reception saying there's people here with cuts and gashes in their head, bleeding out, and people's arms broken. And I'm just here for a 5-minute procedure to have a dressing changed. And the reason I was stuck at the hospital and had to go to A&E for that was because we don't have the resources on the NHS to provide care for people to come out to somebody's home and change a dressing. Now, I've done nursing before. I've got the techniques to be able to change a dressing, but if it's on my back or like somewhere I can't see, I can't physically do that myself. Had I been able to do that dressing myself because it was somewhere I was able to reach and see, I would have done it no problem and just saved their time, because I don't want to be taking up their time. But I only go to hospital or to see a doctor for a genuine reason. I'm not the only person in my house that has chronic health issues. I have a son that has chronic health. I have a daughter that has chronic pain. And the majority of the time, I'm visiting people in hospital that are in my family, or I'm going to appointments that are not just mine, they're also my children's as well. So I'm not disputing the fact that I go to the hospital or I use the NHS a lot. When you have chronic health issues, you automatically will have a lot of appointments, and you will have a lot of people that you have to see, like physios, occupational therapists, consultants, specialists, cardiology, GI doctors, urology appointments. You have a lot of appointments. It just comes with the territory of having a chronic health issue. And if you have a chronic health issue and you would choose to rather ignore them appointments, then that's your choice. But I tend to go because at the end of the day, I'm a single mum and I have 3 kids that rely on me. So I would like to go to my appointments to make sure that I'm healthy enough to take care of them. So yes, I do use the NHS. But that's what it's there for. It's there for when you're sick. It's there for when you need it. And it's there to give you appointments as and when. Obviously, I wish the waiting times weren't as long, but unfortunately, I can't do much about that. That's out of my hands. I think it's very important to be kind. And I was always taught growing up, and this may be an old phrase, but I was always told growing up that if you have nothing nice to say, to someone, then it'd probably be better for you to say absolutely nothing. And I still stick to that to this day, because at the end of the day, you know, we also had a philosophy when I was growing up of a rhyme that we used to do that said, sticks and stones can break your bones, but names will never harm you. And I think that's a very false statement, because yes, you can be battered and bruised and have broken bones from sticks and stones being thrown at you or crushing down on you. But words are our biggest form of negativity, abuse, and unkindness that we can have. And I think that everybody should start using the words as a positive setting and in a positive way. You know, if you see someone struggling and you want to help, ask them, do they need help? You know, if you see that someone's miserable and down, ask them, can you help them? What's wrong? You know, like an old lady crossing the road. You know, I mean, it's so easy for people to see an old lady struggling across the road with some shopping bags and walking really, really slowly, and traffic's really bad, and they just walk past. You know what I mean? And it's so much nicer if you go over and you say, can I carry them bags for you while we help you cross the road? You know what I mean? And I remember I was in a shop a couple of weeks ago because I had a bill to pay. I had to go because I had to take ID with me to pay this bill. And I decided to pick up some bits for the children. I had my 2 crutches with me, and because I tend to go out with 2 crutches these days. And the lady at the cashier, which doesn't always happen, but the lady at the cashier asked me, did I want her to pack my bag for me? And just that act of kindness was enough to cheer me up for the day. It's all about being kind to each other. And I think everyone should be teaching their children that be kind, be helpful, be polite, and accept people for who they are. Don't be judgmental. Don't be criticizing them. Be nice. So this is what this video is about. I hope you liked it. And if you did, give it a thumbs up and comment below if you think that, you know, I've missed something out. Even if you agree that people should be nice. Subscribe as well, and you will see other videos coming up. I'm due to do one with regards to my son's condition of nephrotic syndrome. I'm hoping to get it up tomorrow for World Kidney Day, but because it's to do with a kidney issue, I'm forwarding it on to somebody. I would like to put the link below in order to help other people out, so I'm waiting for their approval. But like I said, if you have enjoyed this video, then please like and subscribe, and I will see you again soon. But remember, if you're going to comment, please be kind, and yeah, have a nice day. Bye.